Okay, welcome back to the Shaky Gynecologist. Today I want to talk about something you're guaranteed to deal with in medicine and honestly in life: criticism. Now, we all know about constructive criticism. That's the kind where someone points out what you did wrong, but also gives you something you can actually do about it. Fix this, try that, do it differently next time. May not feel great, but at least there's a path forward. There's an action you can take. And then there's destructive criticism. This is the kind that isn't about helping you improve. It's about frustration, anger, sometimes even ego. And the key feature is this: there is absolutely nothing you can do with it. No direction, no solution, nothing to fix. At its worst, it's a form of bullying. And in medical training, it can sometimes be buried within or even entirely disguised as teaching. I'll give you an example. When I was a first-year resident, about halfway through the year, I got pulled into a room by my chief resident and got a full rundown of everything I did wrong that day. And to be fair, that part was actually constructive. I knew what I needed to fix. But then she said something I still remember almost 30 years later. "You are the worst resident we've ever had." That wasn't exactly constructive, and it stuck. Out of everything from residency, the long hours, the stress, the chaos, that's the moment that comes back the clearest. So what do you do with something like that? Especially when it's coming from someone who has authority over you, a senior resident, an attending, or later on, a partner, even a patient. A few things I've learned. First, it's not about you. It's about them. Their anger, their frustration, their fear. That doesn't mean you ignore useful feedback. I definitely had things to work on as an intern, like everybody does. So my chief resident was right about a lot of it. But you don't have to absorb the emotional part of it. Just like we're trained to sift through all the information we have about a patient and pick out the relevant stuff, same goes for criticism. Second, let them finish. This is really hard. Everything in you is going to want to jump in and defend yourself. Don't. Unless they ask you a direct question, just let it play out. Now, I realize this may fly in the face of everything you know about handling a bully. I was always taught to walk away, and when that's not possible, to push back, defend myself. But the power dynamic here changes that. You obviously can't walk away when a senior resident is berating you. And interrupting really only escalates things. You're not going to win that exchange in the moment anyway. And you risk inviting even more damaging criticism. If it's worth addressing, you can always come back to it later, when they've calmed down and you've had some time to process. And third, you have a choice. You can internalize it or you can let it go. Now, I want to be clear here. I am not saying to get in the habit of ignoring criticism and immediately letting it roll off your back without first processing it. Every critique has to be evaluated. If there's something useful in the criticism, take it, use it, and improve. But the part that's meant to hurt you, you don't have to carry that. Because if you stay in medicine long enough, actually any career, you will be criticized by patients, by colleagues, by people who don't even know you. And part of doing this job is learning what to hold on to and what to leave behind. And it's that step, arriving at an understanding of what's useful and what's not, that gets much quicker with time and practice. Once you've done that, destructive criticism, as awful as it can be, does have one positive aspect. It can help you build a thicker, tougher skin. So thanks for watching. Don't forget to hit the like and subscribe button, and I'll see you soon.